New York City's positivity rate has doubled in the last month, and with the announcement of a vaccine being distributed in the coming weeks, will it be enough to impact the drastic spike that we're seeing in cases? Here with a look at how New York City is working to control the spread, Dr. Ted Long from Test and Trace Corps. Good morning to you, Dr. Long. Thanks for being here again.
Good morning. Thanks for having me.
So, Doctor, let's talk about the positivity rate. Continues to rise in our area. You know the numbers. Your thoughts on why? The Thanksgiving rush, is that a contributing factor right now?
So what we're seeing in terms of the cases going up is a lot of household transmission, a lot of transmission at small gatherings. So yes, what happened around Thanksgiving with people gathering together likely contributed. We're still going to see what the effects of that are over the next several days. So one of my pleas to everybody listening in today is please come out and get tested so that we can know the status of everybody in New York City and keep our city safe.
So I want to get to testing then, because the lines at specific places seem to be frustrating to some people, right? I myself waited in a very long line on Monday just to get a test. So for folks who are going out there and say, I don't have 2 to 3 hours to wait, what's your advice?
Yeah, so we hear you loud and clear. Last week, what we did is when we heard that New Yorkers were waiting in these lines at our sites, we opened 25 new sites, and we now put up a website where you can check the wait times at the sites near to you. If you check during the day, and I check this regularly myself, there's always a site in every borough or multiple sites that have a wait time at our sites of less than 30 minutes. So we can put up the website here in the link, and please go to this site, see what sites have the lowest wait times near you, and come out and get tested. It's always free at our sites.
I want to ask you about that. And we have the image that we can throw up right now, because this was an image from last night, December 2nd at 4 to 6 o'clock, right? So we see a lot of those places that you're talking about. Some of them say no wait time whatsoever. Some say that there's a wait time of 1.5 to 2 hours, 1 to 1.5 hours. But there's a lot of yellow that says not reported yet. What does that mean when you look at this?
Yeah, that's being updated this morning. I do want to make one important note there from what you just said. We're soon to have more than 20 of our sites that have the rapid testing machines. Those sites can have a longer wait. So if you want a rapid test, you may wait in a line that's longer than one of our sites where you can come in and out quickly. But even at those sites, just to make sure that we're meeting you where you are, if you realize, for example, that you in fact can't wait, at every single one of our rapid testing sites, if there's a line, we're going to walk up and down that line and offer you a self-test kit so that you can be done in a matter of minutes. You won't get your result in 15 minutes, but you'll get a result in 1 to 2 days, and we'll call you with it.
Okay, but what does the not reported yet mean? Because that was an accurate portrayal of the time at some point. So for people who are looking at that saying, okay, well, how do I know if there's a line? When they look at that snapshot in time, it wasn't reported. Is it required that places are to report?
Yeah, we just went live with this. So we're updating it every 2 hours. So what you see there when it's reported is completely up-to-date information. So it's not like information from yesterday. The green, meaning there's no wait now, means that literally is right now.
Understood. Okay, and that's updated frequently throughout the day. So urge people, because I know it can be frustrating. You want people to get tested, and then you get there and there's a heck of a line. You're like, oh my goodness, I don't have the time or the energy for this. I have to get back to work. So let's talk about what's happening in New York City. We're seeing a lot more people in the city. Although the lighting of the Rockefeller Tree Center, I don't know if you watched the program last night, had strict viewer rules. I'm sure we're going to see people try to get a glimpse over the next month, right? We also have folks looking at Christmas windows, doing holiday shoppings. There's bound to be more tourists headed to this city. What's your advice? Is the city open for tourism? How is your team really monitoring that?
So I have some clear advice, and then I'll talk about tourists. Look, at the end of the day, we're in a precarious position now. We're seeing upticks. We're seeing our cases and our percent of New Yorkers testing positive doubled from a month ago. We see the vaccine in the future, and that gives us hope. The vaccines are effective. However, we're not there yet, and this is the time, and this is my plea, not to let your guard down, but instead to double your efforts. In New York City, yes, more than 4% of New Yorkers are testing positive every day. But that's actually lower than almost every other big city in the country.
Yeah.
Why that is when you go outside now, New Yorkers are wearing masks. And before Thanksgiving, we had lines because people wanted to get tested. So my plea and my recommendation to you as a doctor is 3 things. Number 1, get tested now. That gives us our line of sight into how we can help you and how we can get people that you may have exposed to also isolate and cut the chain of transmission. Number 2, wear a mask. New Yorkers have been doing it, but this is the time not to let your guard down, especially if you're indoors. And number 3, if one of our contact tracers calls you to figure out who you may have exposed, pick up the phone. And I'm proud to say that right now, we're getting through to and reaching 95% of every single new case in New York City. But that credit doesn't go to us. That credit goes to New Yorkers for trusting us, trusting our contact tracers, and picking up that phone. For travelers coming in, same recommendation. Wear a mask when you come in and get tested before you come and while you're here.
Almost out of time here. I want to get to the news of the Pfizer vaccine expected to be distributed as early as December 15th in New York State. What do residents need to know? Will people need to sign up to get the vaccine? The governor saying that there could be 170,000 doses. What's your take on it?
Yeah, we're still figuring out the plan, which we'll announce shortly, about how the vaccine will be distributed. The Pfizer vaccine looks effective. I just want to make the point again, if I may. This is the time to double our efforts to get tested and wear our mask. We're excited about the vaccine. We will distribute it equitably as soon as we can. But the time between now and then is the critical time for New Yorkers to come together and keep our city safe. Get tested, wear a mask, pick up the phone for our contact tracers.
Have you had trouble with people? In New Jersey, there was like 60 to 80% of people did not answer the phone. Are you seeing a good number?
So we're reaching 95% of every single new case of coronavirus in New York City right now. We have one of the highest response rates that I'm familiar with across the country, if not the world. New Yorkers are coming out. New Yorkers are picking up the phone. We're keeping our city safe. And our percent positivity, or the level of virus, while high, is lower than in other places.
All right, Dr. Long.
We need to keep that going.
Understood. I agree with you there. Stay safe to you. Thank you for coming on. You're welcome back anytime. Appreciate your voice this morning.
Anytime. Thanks for having me.